Aloha e komo mai. Mahalo for joining Kokua Council's first public meeting of 2021. I'm Lila Mower, president of Kokua Council, and with the aid of my colleagues, hope to provide you with more detailed information and candid perspectives regarding the COVID-19 pandemic. We are here today with Dr. Victoria Fan, who is chair of the Hawaii Pandemic Applied Modeling Work Group. Actually, in a few minutes with Dr. Fan, I'm going to ask Dr. Fan to introduce herself more thoroughly because she has a very impressive resume. During recent hurricane alerts and warnings, we learned that Hawaii citizens are interested in the science of modeling and projecting possible outcomes to counter our vulnerabilities. The pandemic has introduced us to different models on which our government agencies, nonprofits, businesses, and families build plans and design policies. We contacted Dr. Fan to address Hawaii's current status regarding the pandemic, provide insights into what has been done, whether well or poorly, and share her thoughts about Hawaii's near-term future. The United States has about 4% of the world's population, but we suffered nearly 20% of the global deaths due to the virus. Last week, the United States had registered nearly 25 million cases and over 400,000 deaths. In Hawaii, the number of cases now exceed 25,000, and it was reported that Hawaii has suffered 342 deaths. Locally, more than 80% of the COVID-19 related deaths in Hawaii have been among people older than 65. Nationally, 40% of all COVID-19 related deaths in the United States occurred in nursing homes. Vaccination efforts to mitigate the pandemic started in December, and today the Queen's healthcare system has joined the effort with a pod located at the Neil Blaisdell Center. Because seniors are among the most vulnerable, they're among the first to be vaccinated. Here, I'd like to turn the presentation over to Dr. Fan, who's welcome to share her background, her studies, her expertise and experience with this pandemic, and to offer her vision about our near future. After Dr. Fan's presentation, we will have a question and answer period, which may address some of the concerns felt by Kokua Council's general public. Dr. Fan, it's all yours. Thank you.
Thank you, Lila. Thank you, Rick. Thank you, everyone in the Kokua Council, and for all the listeners out there. Thanks for listening. My name is Victoria Fan. I'm a faculty member at the University of Hawai at Mānoa. Recently, on January 1st, I got appointed as the interim director for the Center on Aging in the Myron B. Thompson School of Social Work and Public Health. And I also am the director of our research lab called the Pacific Health Analytics Collaborative, which works very closely with the Department of Health on a variety of issue areas, particularly related to COVID. I was asked by Rick to talk a little bit about, and Lila to talk a bit about, where we are with COVID here in Hawaii, but specifically given this council here to talk a little bit about kupuna and where kupuna fit into COVID-19. Obviously, we all know COVID-19 is hitting kupuna the hardest by many measures. It's really hitting kupuna the hardest. And so what I initially did was I prepared a set of slides, initially focused on the statistics to kind of give you a bit of a picture about where kupuna are in terms of COVID-19. But given this broader framing, I think that Lila and Rick have started actually about where we are overall with COVID-19. I wanted to actually just share some resources available to you for the public about how to find more information in terms of the data about where Hawaii is in terms of COVID-19. So with that, I'm going to just share my screen and hopefully this works. So the first thing I want to just show you, actually just recently we had a data dashboard workshop with Civil Beat, and you can I can share the link with you, which goes through some of the important dashboards that are available to give you a fairly real-time and current situation picture about COVID-19 in the state. But what you could do is you could go to hawaiicovid19.com /data-dashboard, and I'll also send you this link here in the chat window in case you want to look at it and play along simultaneously. If you click on the View Data Dashboard, it will actually take you to this other page here, which is administered by the Hawaii Emergency Management Agency. I myself am not a Hawaii Emergency Management Agency employee, but I wanted to just show this resource to you to give you a sense of where we are for the whole state. So you can see the total number of tests that have been conducted in the state, the test positivity, so what percentage of the tests have turned out positive. This tends to be a slightly leading indicator, meaning it gives you a little bit of a sense of how bad the situation could be. The higher this positivity rate may give you a sense that in 1 or 2 days, the case count may also actually increase as well. Here we have the confirmed cases, so 25,000. More than 25,000 cases in Hawaii since we started testing, and a slight increase from the previous day. It gives you also the number of new cases in the last 24-hour period, and it compares it to the average number of cases average over the past seven days. So usually if your new cases is higher than your average cases, this should be cause for concern. And then reported cases over the last 14 days is a kind of a proxy measure for, how many sort of active COVID cases are potentially circulating around, right? Because it may take 2 weeks, sometimes it takes longer, sometimes it takes shorter for your COVID symptoms to resolve itself, but could be, roughly in the past 2 weeks, all the new positive cases that were detected could represent all of the individuals in the state that have COVID, as of today, potentially. Okay, it also talks about the total numbers of deaths and the fatality rate, and it gives you also a time series, a graph over time. HiEMA, that's their acronym, HiEMA. They're very good and responsive, and have been made a number of changes and improvements. And so if you have specific suggestions or questions about what other data you're interested in, please let me know, and I can forward it on to them about specific data requests that might be relevant for you. It also talks about within these tabs here below, you can see the other pieces. So the summary, a dashboard is like when you're driving, you can see, am I driving very fast? How many RPMs do I have? How much gas do I have left? Basically, am I driving too fast or too slow? Well, this dashboard to some extent gives us a little bit of picture of how fast is COVID growing in our state, and how severe is the situation. Of course, there are some other areas that you may have questions about, regarding capacity and things. And I think those are all areas for potential improvement for these dashboards. It also shows the number of currently hospitalized relative to those who've been hospitalized cumulatively. And then the ICU capacity as well, which many of you know, being a respiratory condition, a very severe acute respiratory condition often can lead to the need for ventilation support in the ICU. Of course, when it gets to that stage, mortality is quite a bit higher as well. And then we've got just a more detailed look about the total number of cases. And then you can see the breakdowns by county here. And then the deaths. And of course, it would be great if this was broken down by age. And so I think that would be a great suggestion, potentially, if Kokua Council were to make that request. That may be something that they would be able to share, but currently that's not listed here. The testing, again, the number of tests, and then a detailed list of their definitions. I really like their list of definitions here. And this is the Hawaii Emergency Management Agency COVID-19 dashboard. And you can also look into other aspects here in terms of economic considerations, the safe travels, how many travelers are coming in, the health trends data. So within the Department of Health, the Disease Outbreak Control Division is the originating de facto source of information about the case count. And so they would be the source. If there's any discrepancy about case count, the definitive source is the DOC-D number. I'll talk a little bit about the forecasts and our role with the convening this Hawaii Pandemic Applied Modeling Work Group to do this forecasting. The mobility index, if you're interested, will show some interesting information about how much mobility, how much people are moving around, which is obviously a risk factor for more COVID spreading, and then other considerations about social trends. So moving on, I want to just show you the DocD dashboard. And the DocD, again, DocD stands for Disease Outbreak Control Division. And if you click on that link here on the HiPAM page, data visualizations under health trends, click on DocD COVID-19 updates. And I will actually also send you this link as well in the chat window, should you want to explore this further as well. So here you have the overall breakdown, and then it's a little bit confusing. So what you're going to do is you're going to click on this little button here, more COVID-19 data. Okay, when you click that, then you will get to this bigger dashboard, which has more information. And the nice thing about this one is it just scroll down, so you don't have to click on any other tabs to find stuff. There's nothing hidden in a tab, you just scroll down. And so you can see here, here's the current picture, and these dashboards have an interactive aspect to it where if you have your mouse and you hover over certain points, you can see more information revealed in the dashboard. So going further, they've recently added a vaccine administration update as well in terms of total numbers of doses and the total number that have been administered. Again, it would be nice to have this further broken down by age, but I think that, you know, public requests, I'll just say, do help quite a bit in my view. And here you can see the geographic breakdown by island, and then as you zoom in further, you can see, you know, how much COVID there is for any given locality. If you hover over, you can see the number of cases in the last 14 days. So this may be particularly relevant for you depending on where you're living in. And then this epidemic curve, there's a lot of information here, but I want to just point out that the overall trajectory of where we're going is shown to some extent in the epidemic curve. So, you know, we see here this slight bump up, and largely through the holiday period, people socially gathering against recommendations, and leading to considerable increase in the early January period. Fortunately, that's been slowly coming down rather than increasing. We're seeing a gradual decrease for the rest of the nation as well. So that is a really good sign. You may recall back in August when things really started to ramp up and the cases were just going through the roof. It was very, very concerning. Then the governor did impose additional measures to halt the spread. But after that, you can see, you know, around that time, we had the state reopened through the state safe travels program. And ever since then, around this period, you know, from, I guess, peaking in August 18th, it went down, but it's sort of hovered, not really dropping to the levels that we'd seen earlier in the first you know, the first hump here, much smaller, really dropped pretty much to zero. In the previous round, it did not drop. Sort of this most recent round of transmission, unfortunately, it has not dropped to zero and has continued to hover at this static level of 100 or so. And there's a lot of factors about why that's been, you know, discussion about why that's been. Also, the mayor's, the previous mayor's use of the tier system may have also created some incentives for people to, as they saw the numbers going up, individually taking action to you know, halt the spread, and that may have pushed it down. So it would kind of go up, kind of down, up and down, up and down. And, you know, COVID is a disease that does spread exponentially. And so it's either going up or going down. And so the fact that it's kind of flat is very unusual and indicates that, you know, it's not as though there is suddenly no potential to exponentially spread upwards. It just means that our citizens are making a lot of effort to keep this down despite the increases in cases that are travel related despite the holiday period, and you know, all the other factors which would naturally lead to a kind of an exponential curve that we have seen in the rest of the country, frighteningly. So, but fortunately, this other peak here at the end of the holidays appears to be going down. Knock on wood, that continues to be the case if people continue to do all the necessary safe practices. At this point, you may be wondering, where are our kupuna in this data? That's an excellent question, and I'm hoping to show you some of that data shortly. But as you can scroll down, eventually it gets to the additional breakdowns here. So you can see now the age of COVID-19 cases here. And so you can see the percentage of cases that are represented by, you know, different age groups, age brackets. And you can also see here over time the different age groups. So you can see actually it's young people who are now, they've always been the predominant source, but they do seem to be growing in particular in their case counts. And also we see additional race breakdowns as well. And you could also break it down for hospitalizations and deaths. Okay. So that's the quick rundown from the official statistics from the Department of Health, and I think it is a valuable resource for everyone should you want to know where we are. And if there's other questions or data points that you would like to have, you know, I think you could send your request to me. I could pass it up, or you could also just write to the Department of Health directly and request for that information. I want to show you 3 more dashboards, and I'll run through that. I realize I'm probably going over time here. The next one is what we're calling our COVID-19 forecast. So as you saw from the Department of Health, they don't actually tell you what they think is going to be the situation, whether it's going to go up, go down, go flat. You know, similar to the weather, you check it every day. Well, maybe not here in Hawaii, but when you're living on the U.S. continent, I lived for several years in Boston. You know, you check the weather every single day because you really need to know what the weather's going to be. Now, in a similar way with COVID, I think, you know, you do kind of want to know, is it going to go up or down at least in the next 2 weeks? And based on this current trajectory of a downward slope, we are expecting a slightly flat, a flat curve. So we're not expecting an immediate you know, shooting upwards that we've seen, you know, in early January. We've also shown here additional forecasts. So if you hit show forecast, these forecasts are actually forecasts from a number of other pages from the CDC. So if you actually go back to the HiPAM page and you click on the CDC Mobility Index page, there's within this feature, again, click on case trends, click on forecasting, and from here, you can actually find more information about many of the, I'll insert this for those of you who are really interested in how the modeling works. A lot of information about many different models that have been created by many other researchers to help predict where things are with COVID. So all these different lines here represent different predictions. And you can see that they're, for the most part, much higher than our prediction. Most of these models take into account the national situation, which is very dire. And so fortunately here in Hawaii, we're taking primarily the Hawaii situation into account with some, you know, counting of some of the national situation, obviously through the inbound travelers. But we do think our model is more accurate than the national models because Hawaii is such a small location. You know, the models tend to be weighted towards areas that have big populations. So most of the country is doing fairly poorly right now. And so this seems to indicate a very upward trajectory. In terms of total deaths, also gives you a picture here, hospital beds, ICU beds, active cases, and you can find other information here about some of the other data sources that are being used, and as well as some other data visualizations as well. But in the interest of time, I wanted to also show you 2 other dashboards, and then I'll kind of switch gears into the Kokua Council interest, which is on kupuna. And so in early August, the Behavioral Health Administration, which is one of the important administrations within the Department of Health, was asked to step up its efforts, was asked to actually take on the role of isolation and quarantine in the state. And so as part of those efforts, it recently released a new dashboard on the Hawaii isolation and quarantine. COP actually refers to common operating picture, so we all know where we are with the situation. And it tells you, currently there are 84 individuals in a DOH external isolation quarantine facility. This excludes those individuals quarantining for travel reasons and other reasons that you may be quarantining in your home. So again, this is DOH external quarantine. So it also tells you, how much total units there are available for isolation and quarantine. And by surge capacity, this indicates, some level of slack, which is actually a really good thing in COVID. As you all know now, COVID does grow exponentially, and the situation can change very rapidly in just 2 weeks. It can grow quite exponentially. So having surge capacity is an important feature of a sufficient COVID-19 response. About 9% of all individuals in Hawaii live in a shared bedroom. And that means that, on average, about 9% of COVID cases cannot safely quarantine at home, because if you have COVID, you really should not be sharing your bedroom with someone else. So fortunately, after the Behavioral Health Administration took on the duties for taking on isolation and quarantine, this orange line is that line that you saw from the Disease Outbreak Control Division with that very scary rapid rise in cases. Similarly, the isolation and quarantine efforts were also able to match that demand, and on average hit about more than 9% of all the COVID cases, sort of hitting that 9% benchmark over this period. So while we always hear, perhaps some negative stories about the Department of Health, I'm pleased that at least on the isolation and quarantine side, I think it's a clear success that we've really met and fulfilled the isolation and quarantine demand. Again, some rudimentary statistics here about the total number of individuals and families served, Native Hawaiian, other Pacific Islander, homeless populations, which have a substantial behavioral health component to it. This wouldn't have been possible without the Hawaii Cares program, which I'll talk a little bit about, but it's basically a 24/7 helpline, and you can call 832-3100 or toll free 1-800-753-6879 if you or your loved ones need assistance for mental health treatment or substance use recovery services or isolation and quarantine help. You can call this line, and there have been so many heartbreaking stories about children or adolescents or even family members who have COVID and are asked by their family to leave the house. And at that point, if you're not considered homeless, well, you may well be, because your family's asking you to leave and stay in your yard or elsewhere. So Hawaii Cares is that mechanism for taking in all these calls, and you can see so far the volume of calls to date has exceeded tremendously. We also added capacity for taking calls, but the volume of calls received has been quite high. BHH Surge personal protective equipment is about some of the PPE that's been distributed to some of the behavioral health providers. And then beneath this interactive dashboard is a static picture, is our infographic, which gives you a picture of where we are overall with isolation and quarantine, specifically on Oahu. And you can see here the number of seniors 65 and plus who've received any service and any placement through this particular service. Obviously, this excludes any services that might have been organized or coordinated through City and County Elderly Affairs Division, which is also an important resource for many kupuna as well. And then last but not least is our last dashboard here, the Hawaii Behavioral Health Dashboard. This is our 1.0 version of our dashboard, and lots of information about substance use and mental health. And I invite you all, if you're interested in these areas, to explore and learn more about the situation of mental health and substance use in the state. Obviously, with COVID having major economic impacts for the state, mental health, psychological impacts, social impacts will probably last much longer and much more pervasive than I think the COVID impacts, so to speak. This will be a new version. We're hoping to launch in a week or so, so please stay tuned. It should be located on the same page, www.hawaii.edu/aging/dashboard. So I'll also put this here for you as well. And I know there is interest for kupuna specific statistics because we do have hospital data. And so I'm going to just shift gears now to some of the specific numbers that we pulled out specifically pertaining to kupuna. So just to summarize it, for example, 60 to 69-year-olds represent about 10% of all the COVID cases, but they represent about 22% of all hospitalizations and almost 20% of all the deaths. So it just clearly shows you that seniors are disproportionately impacted by COVID-19. And another key point that I wanted to just pull out for you. So on this link here, which I will share this link with you in the chat window, but it is a little bit hard to navigate because it's for data people. But of the 43 LTC facilities that are listed on that CMS website, at least 27 had more than one COVID case, and about 232 of these of the LTC residents listed in this data source had COVID-19. And so this is just a very quick summary information pulling from the CMS data source as well. We haven't yet gotten breakdowns by age for the vaccination groups, and I believe the Department of Health is probably working on that as well. We also pulled out, just for the presentation for Kokua Council, we looked at the Medicare and Medicaid enrollment by looking at some of the federal government data sources and statistics. And as many of you may know, Medicaid enrollment has been rapidly growing in the state due to the tremendous need and rising unemployment. And also unemployment is not necessarily that suddenly people are aging so much quicker, but rather that unemployment is potentially forcing individuals into retirement or finally taking advantage of their Medicare enrollments. Just a summary of the individuals who are taking advantage of the external isolation quarantine. So just about 8%. So it seems maybe slightly less from the 10% of all COVID cases. Perhaps if you're a senior, you would feel a little bit vulnerable to go to an external location. And obviously a lot of seniors also are able to hopefully safely isolate and quarantine at home or in their facility, although that's, I think, an important question to ask. And then I want to just jump over to some of the hospitalization data that we've managed to pull out as well. And this goes to show you just some of the differences in terms of the top causes of hospitalization among seniors. So circulatory system related, infectious disease related. This would likely potentially include COVID as well, digestive, respiratory injury and poisoning, compared to young people under 65, clearly a different sort of cause of death and sort of main causes of hospitalization. We also pulled out information about substance use and mental health relating to kupuna. And we pulled out information about, roughly, I think in 2019, 511 kupuna there had hospital inpatients relating to mental health and substance use. You can see the different types of conditions: dementia, bipolar disorders, alcohol-related disorders, major depressive disorders, schizophrenia, and so on. And finally, I've just probably just hammered piles and piles of statistics, but I just want to point one last thing, which is in our work with the Behavioral Health Administration, we have been working on what's called the Hawaii Opioid Initiative. And in this previous report, if you haven't already seen it, you can check it out, but there is some statistics there about those adults who are disproportionately affected by opioid overdose. So those 50 to 59 and 60 to 69 are sort of key categories of individuals who are likely unintentionally dying from opioid overdose. And we also have an additional drug use dashboard, which is similar to our behavioral health dashboard, but has more information specifically on the different types of substances that may be of interest. I think I've just given you just a very, very boring summary of all of this data. As there's so much information out there, you know, I welcome your feedback and looking forward to getting your comments about what questions you have and what information you'd like, and how we can help to try to get that for you.
Thank you very much, Dr. Fan. If you don't mind, I have a few questions for you. You know, the data that you showed us on the pandemic, all the different dashboards, couple of questions. We've been hearing about all these new variants, and has that taken, you know, those variants been taken into consideration? We also hear about genomic surveillance and the importance of it, and that University of Hawaii has developed a program, if you will. Could you address those things?
Yeah, absolutely. So the state laboratories led by the Department of Health has begun doing genomic surveillance. The United States is unfortunately behind relative to the UK and other nations that are doing genomic surveillance. The state has yet to detect the new strains, although it is just a matter of time before they are detected. And, you know, the research about the new strains, like so much of COVID, is an ever-changing situation. If there's anything COVID taught us, it's that our knowledge is constantly changing. And so just as our knowledge of COVID has changed, is it asymptomatic? Do we need to wear masks? Does it spread person to person? That knowledge has changed over time. So too is our knowledge about these emerging strains also changing. Is it more deadly? Initially, they said it wasn't, but now there's some evidence it may be more deadly. Will the vaccines protect against it? Of course, cautious optimism, which is, I think, perhaps what everyone wants, is hopefully that it it does confer protection. Although, again, we don't know. I think the discomfort of not knowing is something that I think COVID has taught us. We have to get more comfortable with not knowing, and therefore making policy and programs to respond to our ignorance. And that's where the genomic surveillance program will be very important to help us track and detect the new strains, and not just the B117 strain from initially identified in the UK, but several other strains in South Africa and other places. The University of Hawaii has a certified lab for COVID testing led by Dr. Vivek Nerukar in the medical school, and other researchers such as Dr. Margaret Butler is also working to develop a collaboration with the Department of Health to do additional genomic surveillance, and I think it's called genomic sequencing is what it's called. And if you're specifically interested in that, I'd be happy to connect you to the relevant individuals.
Thank you. All right, Rick, do you have your question?
I have many. That's a lot of great information, Dr. Fan. I really appreciate everything that you've shared. Although it's a little bit information overload right now. We'll have to take some time to go back and look at all of this. In all of that information, so we keep hearing about herd immunization. Is there in that dashboard anywhere, or even in your just thoughts, what's it going to take to reach herd immunization or that status?
Yeah, so herd immunity is a concept within infectious diseases that indicates that, you know, when there are enough people who are immune, that it helps to stop the additional spread. So for certain diseases, it needs to have a certain threshold. So measles, for example, is a very infectious disease, and they suggest that at least 90 to 95% of the population is immunized against measles. Otherwise, you'll see measles outbreaks if it's not that high. other conditions may have lower thresholds. I think it's yet to be seen exactly what is the minimum level that would be needed for herd immunity for COVID-19. And I think, again, we really don't know. I may have seen a statement from Dr. Fauci, but please don't quote me on it. I think it was 90% is what they're aiming for. The higher we go, I think the better. Hard to imagine a scenario where you wouldn't want to get higher immunity, higher vaccination rates. Of course, just like the flu, this thing seems to be evolving and quite rapidly, actually. And so more rapid than the flu, it turns out. And so, I think it's yet to be seen, just how well the current set of approved vaccines how much they'll protect us against these new strains. So so much unknown is all I have to say.
Second part of the question is, so if we do not reach herd immunity, what happens if we don't get there?
I think, regardless of, while vaccination and immunization is a very important public health strategy, no doubt the invention of vaccines and in particular the development of this particular set of vaccines for COVID-19 is just an amazing medical miracle to some extent. But we absolutely, as a state, cannot neglect the individual behaviors as well as the public health control activities, right? So our individual behaviors of masking, washing your hands, 20 seconds, keeping apart as much as possible, those still apply even with vaccination. And then in terms of the public health control activities, testing individuals, in addition to testing, tracing those individuals, finding out their exposed contacts, and then most importantly is isolating those contacts and positive cases, right? So in some sense, even if you don't test, but you think you might be positive, you should probably isolate, and that in itself will be a huge way to protect others. So of course, the social isolation and psychological isolation impacts are also quite severe as well. So it's no easy answers with COVID. Yeah.
Thank you.
All right, up next is, let's see now, Doug. Are you ready, Doug?
Yeah, I am. Hey, thanks a lot. Really appreciate all the information. Even on my social media networks of like-minded people, by definition, there's a lot of disagreement on what COVID is, how real it is, how good the vaccines are, and that sort of thing. Let me just introduce myself. I'm Doug Matsuoka. I'm a volunteer director at Kokua Council. I work for Hawaii Meals on Wheels that deals with a lot of seniors. And I participate in Food Not Bombs on Sunday, which is a volunteer organization that provides food for mostly for homeless people or marginally housed people at Thomas Square. And they're mostly older people that we see there. But my questions and comments spring from my own vast ignorance on the topic. Let me ask you one question now. I have a lot of questions. Let me ask you one. We know that the vaccination line takes into account a number of things, I guess, one's age, the essentialness of your work and how close you work with older people, and whether you have underlying conditions or not. Now, there's no single entity that knows those three things. And a lot of the questions I get back and forth is how do we get in line and how do we get in the right line? How do we make sure we're going to get our vaccine?
Yeah. So again, I'm not a Department of Health representative, but I will show again. HawaiiCovid19.com is the central location where you can find out information. And the information about the vaccination here, if you click on how to register for vaccination, learn who's eligible, how to sign up, click on view registration directory. And from here, if you are senior age 75 or older, you're now eligible to register. Take a moment to review the pre-vaccination sheet. And here is some of the key questions that it will ask you. And then from there, beneath that, it indicates the individual links for these organizations about how you can register for them. So if you tend to go, if you have HMSA, or even if you're not an HMSA member, you could potentially click on this Hawaii Pacific Health link, for example, and click here about how to sign up. So it's by appointment only, and you're supposed to, it says here, use your My Chart, and you'd have to sign up through this link here. And you can also try to call these locations as well. But it seems that if you are a Hawaii Pacific Health client and patient, you must have the My Chart in order to schedule an appointment. If you're not a patient, or if you don't have a My Chart account, fill out our online appointment form, instructions to schedule an appointment. So click on this page here. I'm just walking you through this. I've never actually gone and done this myself here, but I guess we'll learn shortly if it actually works. We'll just check here. So I guess it's still loading, and maybe if it doesn't work out, you could try a different location. I guess it's not optimized. Depending if HPH is filled, then you'd have to go to Adventist, and if Adventist filled, maybe KP, and if KP is not available, maybe Queens. So unfortunately, it's a very fragmented system. There's also one for the VA, and perhaps in an ideal world, it would just be one system, make life easier for everyone. But that's how it is right now, as far as I can. Let's go back to the HPH page. So I'm going to cut and paste this link for you all, and you can, I guess, send that link to your friends and family, those 60, 75 years and older, and fill out this information to sign up. I'm not sure what happens after that. Will they call you? Will they contact you? Will they email you? So yeah, unclear.
All right, thank you.
And there are a lot of people, Kokua Council people, that are in the what's called the aging network that would also, I actually, since posing this question, I'm scheduled to get a shot tomorrow, but I know a lot of aging network people, we're asking each other, how to get in line. But thanks for the info. I just wanted to put that comment in. I'm done for now.
Thank you, Doug. Thank you, Dr. Fan. All right, just to let you know, my friends and colleagues who've registered for these vaccinations have been contacted via email and by phone. So I find that interesting. All right, Jim Shon, are you ready for your question?
Yes, can you hear me? Okay, there's a lot of data. You're looking at this data. Data without interpretation is just one number after another, right? So if you look at this data and you were asked to come up with a Dr. Fan plan, what would be different than what we're doing? I think you've sort of already indicated, we don't know if these computer systems and signups are working well. So I'd like you to give us a little expertise interpretation from policy, not necessarily to say they're doing a good job or a bad job, but where's the data not connecting at this point with the systems and the delivery that we need?
Jimmy, you asked a fantastic question. I think it's a question that would sometimes it's not easy to answer because Hawaii is such a small place.
Yeah,
and,
I know.
Try not to put your foot in your mouth, but think it's fair to say COVID has been extremely taxing for the government. And generally, we don't think of the government as nimble, responsive, or able to have quick surge capacity, right? Those are adjectives you don't usually think of when you think of government. Hawaii government, federal government, you name it, government in general is not nimble, generally not responsive, not very responsive, and not often able to respond to major surges, which is what COVID is. COVID does grow very exponentially, and that surging nature of COVID makes it very hard for the government to adequately respond. So let me just start with that. I would say that in order for any entity to respond, it needs collaboration and partnership. And this is where I think the Behavioral Health and Homelessness Statewide Unified Response Group has been very successful, recognizing that, it can't just be the government that responds. It needs to be an all hands on deck effort. So even collaboration between the Department of Health and the Governor's Coordinator on Homelessness, as well as the Homeless Programs Office, the University of Hawai, the city and county governments, I think it is one example where working together has been, I think, very, very successful. And even just to give you an example, just for the isolation and quarantine efforts, right? I mean, pulling off a massive increase in isolation and quarantine capacity over a short period of time is very challenging. But if you bring people together and work together, things are possible. So it may seem like it's just the Department of Health that's just doing isolation quarantine, but when you actually look into all the partners that have been involved, it's actually quite a large number. So I would say collaboration, cooperation, working together is also really important, and also something often that government is not really suited or used to doing as well. So nimbleness, responsiveness, surge capacity, and working together, I think those are really, really important features. And the data piece, I think, is critical. I think, having the data systems in place to know how things are going, this has been a huge evolution over time, and still a lot more work that needs to be done. But I would say that the biggest challenge with all of our data is the fragmentation of data. Just as I just showed you with the vaccines, each provider has its own data source. Now, in order for the government to report on that, it has to then compile all those individual data sources. That takes additional time. It would have perhaps been, I don't know what happened, how it was developed in that manner. I wasn't involved in that vaccine planning process, but in some regards, having a centralized data system can help to have more timely information, more accurate information. Of course, there are trade-offs to that because, when it's centralized, Americans in general have a very strong view of privacy, and they may, on the one hand, may feel okay and comfortable for Hawaii Pacific Health to have their health data, but for, the entire, state resource in one location, then Americans may start to feel a little bit awkward about the privacy component. So these centralized health databases are one area where certain countries have done a really amazing job. Iceland has a central health record for the entire nation. Taiwan, South Korea, these nations all have, some level of single payer. So all the fragmentation of your insurance plans is also not there. And so having everyone all on one data system does help. And in the absence of that, in our very fragmented healthcare system with all these different providers, all on their different electronic health record, I mean, even in the United States, getting your primary care doctor to get your hospital record is a huge, heavy lift. I mean, when one hospital does not share information with the other hospital for your, specific care, we have data sharing problems. So let alone for this type of public health effort.
If I could just do a short follow-up here. Everything you've said is part of, oh, we're all friends in Hawaii. We don't want to point out where there are gaps between important data and important policy. Volunteers giving shots don't get vaccinated. All these little things, right? So my question to you, maybe you can't answer it today, is could this be an important role of the of your Center on Aging? Someone has got to sort it out from a policy point of view, even truth to power of here's all this data, here's what it means, here's what is missing, and here's where we're not implementing even the science of it. Someone's got to do that. Everybody's got skin in the game, but I think the Center on Aging is positioned to potentially be our arbitrator on this. So you don't have to answer, but I think that's something that is very much needed. There's no healthcare policy center. There's no, and even the Center on Aging has not been a policy center in the sense of, here's our analytics, here's what you need to know, here's what Josh is missing, here's what this is, here's what's doing well. That kind of, because if you talk to legislators, they're as confused as anybody. We need you. Thank you.
Thank you, Jim.
Go ahead, Dr. Fan.
No, I was just going to say, I really appreciate your comments and encouragement. We are definitely trying to be policy relevant and timely and help to make informed decisions, you know, rather than think of the university as an ivory tower that sits in these research articles that maybe, if you're lucky, 10 people read. But, you know, we're producing these products that we think are accessible to the public, these dashboards. It is a little bit, I have to say, a little bit out of the box. Most of my faculty members have never made a dashboard. And it actually doesn't even count as a publication. That's something I'm arguing, is the dashboard is a publication. A website is a publication. So there's certain incentives, you know, from a research perspective that's not quite there yet. But how do we create those incentives for making our technical skills, our research skills relevant for these really urgent issues that our state's facing, whether it's COVID, whether it's Medicare, not having enough funds in the trust funds in about 10 years, Social Security also gonna go, we're gonna hit some cliff fairly soon, right? So I think there's a lot of big questions, and the data is absolutely important, and I'm doing everything I can to try to help to collect those data sources, build up the infrastructure for those data sources. But more importantly, is not just the IT infrastructure, but is also the, you know, the manpower or the workforce. Because when you look at the Department of Health, I can actually count on two hands every single epidemiologist that knows data, and there's not that many of them. And that's a big concern. If they're supposed to be really strong in data, they need more people who know how to do data. And so I think the university has an important role to play to help train that next generation workforce. And, you know, as I've been telling everyone, that data science is accessible to everyone and anyone. I think it should be a skill that we consider just like math, just like reading, and also playing with a little table in Excel is also data science. Making a graph is also data science. And so we're looking for literally anyone who's interested in data science and analyzing health data, health analytics. So if you go to http:// go.hawaii.edu /AAA. We encourage, you know, 16-year-olds, high school students, college students, and anyone who, even those individuals seeking career change. It is a highly marketable, so-called marketable skill that I think has a lot of potential for higher paying salaries. I think that's one area that, you know, the state has been thinking about. How do we shift? What should our new industry be if it's not going to be tourism? Well, I think a low impact industry from an environmental standpoint could be IT, health analytics. So I'm definitely a data evangelist. And please, you know, if you see any, you know, grandchildren, tell them about data science, health analytics. We're always looking for people. It's actually very hard. to find people. I think what I found is that many students in Hawaii are very lacking in confidence about their abilities to, they hear data science and it sounds like from a different planet, that they're not qualified or able to do it. But we've seen amazing results of our undergraduates who initially they were afraid to open up a data set, and now all of our dashboards are student built. Okay, so just goes to show you how much potential our University of Hawaii students have.
Thank you, Dr. Fan. That was very interesting. John McDermott, are you ready?
I'm ready. My video is blocked, but can you hear me?
Yes.
Okay. So thank you, Dr. Fan, for being here. I had just two quick questions. One is that the Department of Health now, once a week, they put out a cluster report, which is really, really helpful. But there's still kind of a hesitancy to name who they're talking about, if they're talking about, you know, a restaurant or if they're talking about a gym. And for example, I go to 24-Hour Fitness, and the staff there are constantly telling people, you know, wear your mask, and they're announcing over the PA, you know, cover your nose so we don't close. So they're doing everything they're supposed to. And if other places aren't, there's always like this threat that, at least when we had Mayor Caldwell, that he wanted to shut everything down. And that just seemed to be very unfair to me. Same thing with restaurants. I was at a restaurant back in July, and I emailed the Department of Health that I noticed that once people walk in the door, everybody takes their mask off. And so I didn't really feel very safe there. And my suggestion was that you should leave your mask on until the food comes. You can still be talking. And the response from the Department of Health was that DOH must prioritize its regulatory activities, and the fact that restaurants are open for the sole purpose of socializing would make it impractical to make such a rule or to start an ad campaign that cannot be enforced. So I don't really have a lot of faith with our Department of Health, because I thought that was kind of like a no-brainer suggestion, but that was shot down. So the first question is just, can the cluster reports start including the names of businesses where these outbreaks occur? Because I think shaming works in encouraging people to enforce the rules. And the second question, real fast, is regarding the care homes and the foster homes. When we have these mobile units that are coming in and doing the vaccination of the residents, I really think that they should also include anybody living in that house who's a senior. A lot of our caregivers have their parents living with them or their aunties and uncles. So they are of an age where getting the vaccine could be, you know, lethal, and they can catch it and they can also spread it. So it doesn't make sense to me, and I wonder what you think, to, you know, go to the home and not vaccinate everybody who is considered at high risk. Thank you.
Well, John, you've asked some really tough questions here. So, you know, on the cluster report, you know, I am appreciative that the Department of Health has started to push this out. As you can see here, as a sample, that they, as you noted, they only list the establishment facility categories, so correctional facilities or educational settings, food suppliers, restaurants, and so on. And I don't disagree with you that the release of specific establishment names would potentially have a more disciplining or shaming potential effect. And I feel I'm not able to comment about why the Department of Health has chosen to leave it at this general category, with perhaps the exception that they may not want to identify individuals out of respect for protecting individual identity, depending on the educational setting or the specific establishment location. It may be possible to, you know, identify whether someone is in fact a COVID case from that particular, you know, business or establishment. And so I think it goes to show the level of concern about privacy in the United States, a concern for privacy and protecting patient privacy perhaps to an extreme. And when you look at other nations, which nations have released information about specific locations of COVID infections, I think there's also some variation about the extent to which nations do publish specific locations as well, for the same reason that many other countries have looked to the United States for, setting the benchmark about protecting people's health information. And so many of them have modeled after US HIPAA and protecting patient privacy. So there may be more targeted ways to informing individuals. Really, it's more about exposure. I think that's what you're concerned about, potentially. So if you had gone to a particular restaurant, ideally, and someone had tested positive at that restaurant, it is good public health practice to notify those individuals that they have been exposed potentially. Now, the issue is, of course, whether or not the contact tracing system and the notification system is actually working in such a manner that would actually adequately notify you. And so the Department of Health has been working on this system called Aloha Trace to help expedite this notification. And I'm not an expert in this particular technology, but it's, is it Aloha Trace? I'm sorry, it's not Aloha Trace. It's Aloha Safe. There's a new app. I'm just forgetting what the app is called. Exposure notification app. Anyway, clearly this is Aloha Safe Alert is what it's called. Sorry, Aloha Safe Alert. And the idea is that there's ways, if you install this app on your phone, if you've been in close proximity with someone who has COVID, that you would get a notification that you may have been exposed to COVID. And it's been built out by the leading tech companies to ideally protect as much privacy as you can, due to the American preference for privacy protections. So if you are going out to restaurants, which some people apparently are doing, I personally am not going to any restaurants, but if you are going to restaurants, then you may want to install this app should you discover that potentially it may be more efficient than actually waiting for the Department of Health's Disease Outbreak Control Division to call you through one of their contact tracers, which would be the normal mechanism for notification should you have been exposed to COVID, right? So a proper COVID-19 contact tracing mechanism would be that the restaurant would identify all the positive cases at that one restaurant, and then the restaurant would then notify every single person that had gone to that restaurant. Now, our restaurants taking people's personal information to contact the individuals that, in other nations, people are actually doing a log to get their contact information so that they can get a phone call if they were possibly exposed. Seems like a lot more work potentially, but is one way to potentially help to ensure that the disease does not spread any further. And in the absence of that, old school phone tree, there is Aloha Safe Alert. And the second question that you had, John, I'm sorry, it was about
regarding the care homes and foster homes, and caregivers have parents and aunties and uncles living in the same house.
Yeah, I think the Department of Health has come up with a vaccine prioritization schedule, and that is the schedule. And perhaps it should have been a different schedule. Perhaps there's some pros and cons. Anyway, it's almost, I feel out of my role to at this point change what the prioritization schedule is. Obviously there is some logical basis for what you've just described, John, about potentially having other families vaccinated. If you have one of the individuals already vaccinated, doesn't it make sense then therefore to also vaccinate the others in the home? Perhaps it's actually a bigger question about whether home care workers are considered workers and about whether home care workers essential workers? And if so, are they part of phase 1B? And if they're not, then maybe they should have been added to that list. I think home care workers often, I was just reading, very accidentally was just reading up about it, IGEN, POO, and the National Domestic Home Workers Alliance. and the notion that certified nurse aides and other home workers are often underpaid and undercompensated, and there's huge turnover in home care workers. And I think it's a bigger question about the potential recognition of home care workers and ensuring that they are safely and adequately protected. But
well,
sometimes
my understanding is that the Department of Health has said that care facilities, including care homes and foster homes, are on the priority list. And I think 2 caregivers, because the assumption is that the caregiver spouse is kind of a substitute caregiver. But there are other seniors living in that house, and they certainly fit the priority in terms of age. And because they're living with people who are already compromised to some degree, it just seems to me that, you know, the potential that they also catch or that they also spread the virus should be taken very seriously. So if you're going into the house anyway, if you have this mobile unit that's providing the vaccination, it just seems silly to expect, you know, those folks to do it on their own. You're in the home, you know, let's just get this all over with. So that's my opinion. I wasn't sure what influence you have with the Department of Health to tell them what to do.
I'm just a very small actor in the, I'm not even a DOH employee, but I think, you know, I think the Department of Health can be more responsive, and through your channels in the Executive Office of Aging, or I think I've seen other types of approaches to exert influence. I think we're all sort of familiar with what those channels are. There are legislators potentially, there's also media, but honestly, it's not clear to me whether the vaccination plan is open for change at this time. But my personal view is that COVID is constantly changing. So we have to be willing to change. And our understanding of things have changed, is always changing. And even plans pulled together may have errors potentially, and could be reconsidered with potential better impact. But I would say, yeah, I don't give up hope yet, John. Maybe we could talk further. Maybe there's some potential research that you could do to see how much of an impact that could make. There are some modelers in HiPAM that have been looking at different vaccination strategies, and you know, some vaccination strategies have actually found that actually if you vaccinate young people, who are the ones who are actually really spreading the condition, that may actually lead to a more effective impact in controlling the spread. But of course, they are in phase 4. So, you know, it depends on what you're valuing and prioritizing. The logic, I think, for prioritizing seniors, obviously, is that they have disproportionate mortality impacts from COVID. But from an infectiousness perspective, it perhaps could have been younger people. And it depends on what it is you're trying to optimize or sort of improve. So, like everything in this field, there's no easy answers. Sometimes you feel like you're pushing from one, taking from another. So yeah, taking from one hand, giving to another hand.
Thank you.
Thank you, Dr. Fan. Thank you, John. Jean, do you have a question for Dr. Fan? I don't see Jean. Let's see. Okay, if not Jean, let's see, let's go on. Dale.
Oh, Lila, I'm sorry, I was muted, but I just wanted to say thank you very much. I found it very informative. Mahalo.
Thank you, Jean. All right, Dale, your question, please.
Oh, Dr. Fan, thank you so much for all these wonderful work you're doing. I'm amazed at these charts. Good graphics there. Anyhow, I'm a retired blue-collar guy from Pearl Harbor Shipyard. I was only a mechanic, not up there in academic level with professional folks. My family, the trivia of the males, they check out of life between age 60 and 72, and I'm 71. So I've been watching this with some alarm bells going off, and then last night for humor, I was watching PBS and someone asked a question of a professional about how often this thing mutates. The response is, well, while we're talking, there's been a mutation already somewhere in the world. Since the war of microbes against us, we appreciate being protected by the scientists and the medical people. But while we presently have an undersupply of effective vaccines as time goes by, for those of us who can avoid getting infected, eventually we'll get to where we have an oversupply of the vaccine. So once we've all got some sort of vaccination, we might give some thought to, oh, well, since there's an abundant oversupply, hey, why not get the second one from another manufacturer? I would call that cross-vaccination. That's a premature thought, but still, it's a philosophical one. So might you have a thought on that one?
I think the CDC may have just put out some guidance about mixing and matching the different vaccines.
Wow.
I have
Impressive.
I haven't actually read through it yet, but I think they said they weren't against it, but it wasn't advised. I think that was the gist of it. It wasn't necessarily recommended that you do that, except if, you know, under certain dire circumstances that you have no other choice. So.
All right, thank you, Doctor.
Thank you, Dale. Thank you, Dr. Fan. All right, Gary, are you ready with your question?
I am ready. Thank you, Lila. Thank you, Dr. Fan. I guess looking ahead, and you know, you've alluded to it just a couple minutes ago, that in terms of funding, we're taking money from one place to put it to another. There's just not an infinite source of funding. Given what we're continuing to experience in this pandemic, what do we need to fund in terms of global health and economics? What do we have to increase? So, I mean, what is the one area I guess you would like to see increased funding in for good outcomes? Thank you, Dr. Fan.
Thank you, Gary. That's a really excellent question. And in my role as a health economist, that's usually what I think of is there's a budget constraint. There's a budget and you have to decide, am I gonna pay for more of this or more of that? And what's worse is that we're not just in a flat budget, we're in a much lower budget than before, which means that things will have to be cut. That's just the reality, I think. And the de facto approach, I think, for many budget thinkers is just to do an across the board cut. Whatever the cut is, just take some proportional cut. But I do think that may have risks, as you've just pointed out, that perhaps we should keep some things going more than others. And I do think those are really, really hard questions. If I was the governor, you know, you're looking at a portfolio of many different sectors or industries and many different considerations. But I think perhaps the biggest consideration for from the state's perspective, I mean, it depends on what your objective as a policymaker is, but presumably your objective as a policymaker is economic growth, because without that, everything else hinges upon having, you know, adequate tax revenues into the state. And when the tourist economy is clearly down with no obvious sign or deadline of recovery, then the real question is, well, what is going to be our economic engine for the state if it's not tourism? And if tourism, you know, despite the safe travels approach, we haven't seen the recovery that we would have liked, not surprisingly, because the whole world is experiencing COVID pandemic. So not surprisingly, travel is down globally. And as I do not expect travel to recover anytime soon, then Hawaii will also be disproportionately affected and dependent on this travel industry. So we have to kind of think through new industries and new revenues as a state. And I think it's been a long discussion for the state about what should our new industries be. Should it be IT? Should it be biological science? Should it be cultural tourism? all sorts of discussions. I think we need to have that debate and that discussion. I don't have the answers for that, but I think we do need to have a discussion, a real discussion, although I guess Zoom is a real discussion, but a real Zoom discussion about how the state needs to redesign its economic engine when this one engine is a little bit old and it's kind of run its course, and we need to find a new engine. And honestly, with climate change on the horizon, even if maybe climate change is already really hitting us now, but when sea levels rise, our beaches disappear, where's tourism going to go at that point? And our climate resilience, you know, is also going to be impacted by tourism. And so why not use this opportunity right now to redesign and plan out a new future for Hawaii? Before it was agriculture, you know, all sorts of other things. So we have to work together and figure out what that is. If we continue to depend on this old economic engine, it's going to be hard days ahead. So I would not to be a Debbie Downer, but I do think, you know, if probably the biggest thing I would say is broadband. Actually, broadband in Hawaii is very weak. Our infrastructure for communications is weak, but in COVID days, it is clearly essential to have high quality broadband. It's like roads. It's the basis of our communication, our information access, our ability to have high quality videos, to learn, you know, distance learning. Everything depends on broadband. And if our broadband is weak, then our economic growth will also be weak. So I would say if I had to put one priority, I would probably put broadband.
Thank you. That was the incisive, precise answer I was looking for. I mean, I wasn't looking for broadband. I was just looking for something very incisive and precise. Thank you.
Thank you. Kathy, you're up.
Hi. A new industry could be mask making. Never, did you hear that? Mask making. I thought it was supposed to be funny, but never mind. Okay, I just got 2 bulletins. One said that they're reporting 123 new cases today. And the other bulletin said that the first case of that new, more contagious variant has been identified in Hawaii. That just came across, so I don't know if anybody knows that. But my question, just your thoughts on this. The new administration is opening up all the borders, and illegal immigrants are going to be welcome and all that stuff. And how do you think that's going to affect the COVID pandemic? And what do you see happening with that, with all of those new people coming into the country?
Well, without commenting specifically about immigration policies of the new government, but I will say that as long as there's COVID anywhere, you know, no place, as they say, as some of our global health experts say, no place is safe until every place is safe. So as long as there's COVID anywhere, there's always going to be a concern of potential importation. So in Hawaii,
but if we're having a hard time getting enough vaccine for the people that we're trying to roll out the vaccine for, and for instance, Maui announced last night on the news that they're cutting off appointments for new vaccines because the amount of vaccine they have available is only going to cover the people that already got their first vaccine, and this will be their second vaccine. So my concern is supply and demand and whatnot.
It is very concerning about the vaccine supplies. I think the new CDC director announced yesterday that they do not know what the current vaccine stock is. So I think the situation, again, is evolving quite rapidly, and I'm hoping the new presidential administration will be able to better manage the vaccine distribution supply chains, as they say. But I think, you know, as long as Hawaii is dependent on tourism, which is true for the foreseeable future, we will need to keep the borders open in Hawaii unless we can find an alternative economic engine that we can stand up in a very short period of time to compensate for this massive drop in revenues to the whole state. But the issue about the vaccine distribution plans, I think, absolutely the federal planning trickling down to the state and down to the local counties is hugely important. I can't disagree with you on that one.
Thank you.
All right, next up is Helen Wagner, are you there? Hi, Helen, do you have a question?
Unmute.
Thank
Unmute.
you.
Okay, right. And also, my video is down. You have to undo me. Anyway.
You're unmuted.
But the video is down too. You have to do the video at your end. Anyway,
you have to do it on your end. We cannot do it on our end.
Well, I push it. You cannot start video because the host has disabled it.
All right, try now.
Okay. Okay. Thank you. Okay. My name is Helen Wagner, and I advocate for senior issues. I'm a community advocate, and I sit on the board of directors for several organizations, Hawaii Family Caregivers Coalition and Kokua Council. Currently, I have a 97-year-old mother who refused to go into a care home. And so we're all taking turns caring for her. Now, one of the things you brought up was a broadband. Here in California, we noticed that there is so much venues to hear news. Like we've heard and we read that Norway shut down because they took the vaccine into care homes and 13 of them died. So Norway closed down their vaccines for a few days until they assessed things. And then they put out that it's not to be given to frail, this is the modern one or whatever, to frail or the ones that they did it to were 80-year-olds. So they aren't giving it and they're not advising to give it to anyone frail and over 80 because of their, it's supposedly a little stronger. Then they found that because they found shelved inventory of the virus and they had expiration dates. So this government started saying you can't let these go to waste. So now all of a sudden they started opening up the testing sites to the vaccine sites. Now, a lot of people are having reactions because of the allergy system. So they don't get that information that if you have allergies, you should get it at a facility that can have means to help you. But now they're doing it through mass drive-ins and all that. But then they also changed things. The care homes, they opened up today. They opened up all the restaurants, all the nail places. They said it was too hard on business. Even Como gets on television and he says he made a mistake by putting COVID seniors into care homes. And that was a mistake. Supposedly they were doing it so they could make room for the younger patients. Now we don't hear these things so much in Hawaii because we hear, just like here in California, we hear what we're supposed to hear. But with these broadbands and other venues, and there are a lot of things going on with that. First of all, the death rate isn't very high, considering that it's flu. In fact, they said on TV, well, one thing, it wiped out the flu because there was only 5 flus reported and how many thousands of COVID that day. All of these things, they made a rule that if you're driving the person to get a shot, you can get a shot. There are people waiting outside of Walgreens in case the pharmacy opens up a batch and doesn't distribute them all. Rather than go to waste, they're there waiting for an extra if a shot's available. I know, they have tiers, but and I know that even here in Hawaii, it should be looked at on a daily basis, because we do have a lot of people that, just like Gary said, here in California, there's 2 neighbors that have the flu, the whole household, but they're all home. They're all functioning as a family that has a flu. I don't know, maybe I just see that. I thought that was a sense of herd immunity, because they're all there all together, and that's how they're getting through it. Thank you. What I'd like to ask you, how can we help support that more information get to our legislators, that this is so important? Because right now, focusing on other political things, that's not the concern. Is to really come together and all of us help in any way that we can to get this under control. So what can we do as citizens?
Helen, I think you raised a lot of really interesting points, and I do think, I think it is a natural response to question about the safety of any new product, and like any informed patient or individual receiving any type of medical service, you should ask what are the safety considerations, not just for a vaccine, but for anything that you get from a physician. Just because a physician recommends it doesn't necessarily mean you should take it. That said, I will say that the vaccine is very, very safe. And maybe I'll throw an extra very, 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 very safe. Given the risks so far that we've seen, there have been a few instances of some adverse reactions in people after the vaccine. I think it's roughly 1 in a little bit more than 1 million or 2 million. And so by that measure, we may expect 1 or 2 individuals with a very severe type of anaphylactic type of reaction here in Hawaii overall. That said, if the administration of the vaccines, they do allot time to observe the individual for about 10 to 20 minutes to see if there are any immediate allergic reactions to the vaccine. But overall, it is a very, very safe vaccine. I did see that specific news about Norway, and I think there were potential concerns about the underlying health status of some of those individuals, and that the cause of death may or may not have been necessarily attributable to the vaccine per se, but that there were other coinciding factors. I mean, I think one person put it that they also could have eaten an apple in the morning and then could have also arrived with stomach flu, and it's hard to say so much with causality, but that said, I think rather than dismiss some of the findings, and that is from the Norwegian government, and they do have a very well-respected public health authority, so the amount of evidence that is evolving over time is enormous. It is an enormous amount of information, and it's hard for any state to manage and track that information and evidence. And I would say also that that in some regards, this is what you would hope that the federal government does, is to be able to track and constantly review all the latest research that is coming out at an enormous exponential rate. I know, for example, in Taiwan, they have like a whole team of people just monitoring the news and the research, right? And that could be one team. They've got another team just monitoring social media because that's how they initially detected the strange, acute, they called it some SARS-like pneumonia cases in China. They actually detected it initially on social media before the Chinese government had actually posted any official announcements. So I think it goes to show you the importance of information, timely information, and monitoring that information, which all takes resources. And to the extent that we can crowdsource and rely on the public citizens, netizens, as they say, to keep us abreast of all the information that's going on, I think the better. And we can't assume that, somehow we always think that the experts must know, but honestly, the experts are also very busy working on all kinds of other things as well. And so, to the extent that you're able to share information as well, I think is also really valuable. As far as, what can we do as a state together to really tackle COVID? I have a lot of hope. I want to hope that our state, in many regards, has some of the characteristics that are needed for COVID control. We have a population that is really interested in the group rather than the individual. And as I like to say, COVID exploits your individual desire for freedom and then withholds freedom from everyone for longer. As long as you insist, as long as people insist on having the freedom to go out without a mask and not wash their hands and not take all those necessary precautions, the longer COVID will be withheld from, the longer that we will be in this situation. So we're sort of all in it together. We all have to take all those necessary individual precautions, washing hand, wearing a good face mask, and keeping apart, I think, is the hardest part of it all. Not giving people who are not in your immediate household hugs, avoiding the parties. I had to cancel a party that I saw that my employees were about to hold. I said, we're going to have to cancel this party. And it's hard. It's hard to do that, but everyone wants to just sort of go back to normal, but we have to unfortunately accept the fact that life is not going to go back to normal anytime soon. We're going to be living with COVID for quite some time, at least to the summer, if not the fall, assuming that the mutating virus is less dangerous than it could be. So I think I've spoken too much. I think we're hitting our time, so I'm going to stop here.
Dr. Fan, thank you very much. We appreciate your patient and thoughtful responses to our inquiries and concerns. You can tell that we're lay people and we're not sophisticated in the sciences, but you brought it down to our level. Thank you. We appreciate your assessment of the safety of the vaccine. I think that's really important. A lot of kupuna are, of course, cautious, concerned that the vaccine may be stronger than what they need and may be harmful, but we appreciate your assessment. And you gave us an insight into the future. And I know that that was what I had said at the beginning. And I was thinking, gee, I hope I'm not asking too much of you. I hope that there are people watching who have, like you said, grandchildren and will, your screen in the back says, we're recruiting future data scientists, but you did a great job. You did a great recruitment, if you will. And I hope that there are grandchildren in the audience or grandparents who can lead their grandchildren in that direction. We certainly need more STEM students, as you said. But thank you so much. We appreciate it. It was a great education. Can't say enough. There's so much to be learned about COVID. And you're invited to join us anytime you want to teach us more. Thank you very much. Thank you to the Kokua Council membership for joining us. This is 2021, and this is our first public meeting. We wish everyone truly a much better year. Mahalo nui loa. See you soon. Thank you very much.